I suppose that first of all, I will start with thanking Marifa Management for their continuous efforts during this period of COVID, doing all these activities, represented by Dr. Dua Al-Sayed and her excellent team. Thank you, Mr. Chairman. Thanks goes to the sponsoring companies and supporting institutes, and also thanks goes to the colleagues who are staying with us until this last time. It is very late. Actually, I'm going to go in a more generalized direction rather than being very, very specific and advanced in the field. So I hope the colleagues are going to like this, because it may touch their lives in a way or another. So I suppose that everyone is hearing me and everyone is seeing my slides.
Yes, Dr. Khalaf.
Yes, the slides are very clear and we can hear your voice very nicely.
Thank you very much. Thank you very much. Well, so what we are going to discuss together tonight, actually, what is the gluten-free diet? What are the pros and cons about the use of gluten-free diet? What is the gluten-free diet is in now? What are the differences between wheat allergy, celiac disease, and also another important issue, which is celiac disease and non-celiac gluten sensitivity, or what's called gluten intolerance in another way. Why to be on a gluten-free diet when it's not needed? What about the future? So to start with, we know we are concerned about the monocost, the family, and from that we have the subfamily OED, and from that we have tri-TC. Those are the three inciting agents which are really triggering and eliciting the epitopes of celiac disease: the wheat, the rye, and the barley, and also in one of the subfamily which may do that, but it's not in all cases. If you compare low-carb diet in the recent years and fat-free diet, ketogenic diet, and then gluten-free diet, you will see the gluten-free diet was increasing, but it's still steady. Actually, the market grew at a rate of like 28% from 2004 to 2008, which finished at almost 4.2 billion in 2009. By 2017, the market reached 6.4 billion. In 2018, it reached 17.59 billion. And from 2019 to 2025, it is anticipated to expand more like 9.1% in the sales, and that is actually too much burden. If you just Google free diet, you will see like 112 million results in less than 21 seconds, and that is really a big number when you just Google it. If you go and check Amazon, you will see like one of 16 pages about 117,000 or more of results. Just when you Google that. When you take about the celebrities who are using that, at the top of them will come Clinton, Mr. Clinton, who is on gluten-free diet. So most of the people are interested to hear and to see what is going on and why people are taking gluten-free diet. So the first reason, the reason one for consumer to buy gluten-free diet food is because gluten-free diet is thought to be healthier. But is it necessary? It may be harmful to our health. Is it cost effective? Who will benefit from that gluten-free? All people or some of us are going to benefit. And what the science, what the health professional are talking and saying about that issue. If you see the gluten-free diet, if you check also medically and also you check about celiac, you will see like 20 pages of more than 15,000 posts just by Googling that. When we talk about gluten-free, actually we talk about celiac disease, we talk about wheat allergy, and we talk about non-celiac gluten sensitivity, or what we call gluten intolerance in some people. So we divide them just like that. Is it an autoimmune disease? Then this is a celiac disease. Is it an innate immunity? Then this is non-celiac gluten sensitivity, or it is an allergy. And then allergy, it may be food allergy, it may be Baker asthma, or it may be wheat-dependent exercise-induced anaphylaxis, sometimes which may be fatal. So what is celiac disease? Rapidly going through that, I'm sure all of you know about it. It's an autoimmune disease triggered by consuming the gluten. It affects small intestine and digestive process. It occurs in genetically susceptible people, people having DQ2 and DQ8 positive there. But having those genes not necessarily means that we are going to develop that. Internationally or worldwide, the celiac is about 1.4%, but still most of the people think that this is not the real number, and it is an iceberg phenomena, and there are a lot of cases which are not diagnosed or hidden. So it is an autoimmune disease. It's caused by permanent sensitivity to the gluten in genetically susceptible population, and the people should understand that this is lifelong process. Or in other words, when someone ingests the gluten, it will lead to formation of some antibodies against the tissue transglutaminase, and the patient may present with GI symptoms. Sometimes they may present with non-GI symptoms, and sometimes the patient may be totally, or maybe a person may be totally asymptomatic, but still he has gluten enteropathy. I will skip some of this. Regarding serology, we depend on anti-endomysial antibodies, anti-tissue glutaminase antibodies, and deaminated anti-gliadin antibodies in some cases, and HLI typing, not in all cases. Actually, we need that. So when we should offer these tests, we should offer them when we have someone with unexplained GI symptoms. When there is flattering of growth, a child who's not growing well, when there are periods of prolonged fatigue, when some adults have some sort of resistant irritable bowel syndrome symptoms, or sometimes severe or persistent mouth ulcers, or sometimes unexplained iron deficiency or folate deficiency. Type 1 diabetes, we should do those serological testing at the diagnosis, and autoimmune thyroiditis also, those patients, they need to be screened for that. Unexplained weight loss, even in adults, not only in children, and first degree relative. When we diagnose any case with celiac disease, we should screen all the first degree relative for that. Maybe they have the disease. We should also consider those tests. I'm sorry, I think some people are not unmuted. Sorry. So we should consider also, we have someone with metabolic bone disorders, unexplained some neurological symptoms, unexplained subfertility or frequent miscarriages. Celiac may be the cause, or sometimes you have a patient who's otherwise well and persistently have some sort of elevation of the liver enzymes. We keep that in mind, and we may consider serological testing. Dental animal abnormalities or defect. Patients with Down syndrome, we consider that, and also Turner syndrome. How to test for that? Actually, the patient should be taking a normal diet, which is containing gluten. We should request the serology. First of all, we start with the IgA, anti-tissue glutaminase antibody, and deaminated anti-gliadin peptide, IgG. Or second option, we do transglutaminase antibody with total IgA, because sometimes if the patient is IgA deficient, the the anti-tissue glutamase antibody IgA will be normal or negative, the titer. If the IgG or IgA and deaminated gliadin peptide IgG are positive, then we should send for a small intestinal biopsy, irrespective of the titer. Whatever the titer, the patient should undergo biopsy. Just a simple look to the normal. I'm sure Dr. Azaz is more expert in that field about. You see the glistening duodenum, and here you will see those scalloping in the area, and then in more advanced you will see those nodularities in patients with gluten sensitivity. Histologically speaking, talking about Marsh classification, this is the normal one. There may be some infiltrates in some patients, or there is hyperplasia. But when you go to the classification, either there is partial 3A, villus atrophy, or it is subtotal 3B, or it is 3C when there is total villus atrophy, which can be seen in patients with celiac disease. Then, when you have a patient with suspected celiac disease, so we do a serological test, IgG, IgA, anti-gliadin antibodies, or anti-TG antibodies, and anti-endomycin antibodies. If wheat allergy specific, then you will do IgE. If IgE is positive, then this means, and skin test is positive, this is wheat allergy. If the serology for celiac serology are positive, here we do genetic testing for those patients. If it is positive, then go further, do biopsy. If it is positive, it is Marsh type 3 or above type 4. This is celiac disease. If the patient has negative serological test and the duodenal biopsy is negative and the histology is 0 or 1, Marsh type 1, and we started gluten-free diet, and there were improvement of the symptoms and health condition of the individual, and then after introducing the challenging the patient with the gluten, appearance of those symptoms, this means that this is non-celiac gluten sensitivity or gluten intolerance, and those patients are going to benefit from gluten-free diet. This is simple algorithm, although it may be complicated in another. But I think if you follow this, we can really see that. If the patient is following gluten-free diet, or if the patient is taking gluten-free diet. If he is on gluten-free diet, then you have two options. Either the patient, we do the challenge if the patient accept, and then we do serology performed, and then we will do the biopsy. If the patient is unwilling to do that, then you will do HLI typing for the patient, genotyping, and you'll see if it is negative, then mostly celiac disease is excluded. If it is positive, you will go to the second row as you are doing the celiac serology. If the patient is low risk and it is negative, then there is actually no celiac disease. If it was negative and special review, it may benefit from further evaluation. If the patient still symptomatic, we should do genetic testing plus biopsy. If the patient has positive celiac serology, then you will do the biopsy. If it is normal, then there is no celiac disease. If it is equivocal, then we should revisit the diagnosis and things one again. Sorry. And then if you see the characteristic histology, then this is celiac disease and it is confirmed. What about the new modalities of treatment of celiac disease? Just talking about the future. Many of them are still in the phase 1 and some of them in the discovery phase actually, and none are documented till now. What about wheat allergy? It is an immunoglobulin E mediated immune reaction to the wheat proteins The symptoms start within minutes, maybe up to hours after the exposure. It may be in a form of rhinitis or Baker's asthma after inhaling the wheat flour, leading to wheezing, runny nose, and coughing. Or it may be a food allergy based after eating the wheat, leading to hives and eczema, and sometimes laryngeal edema, anaphylaxis, and even it may lead to death. So all those patients, they should avoid always wheat, and they should always carry with them EpiPen because they may pass into death if they eat that. Well, some people are going to ask if the allergy testing and celiac testing are negative, and he don't have any wheeze or any hives when he eats wheat, but he feel unwell or awful when he eat gluten. What about this? What we are going to tell them? Actually, the gluten reaction without identified allergic or autoimmune mechanism, that is the non-celiac gluten sensitivity. Those patients, they develop the symptoms within hours to few days after the exposure. They have normal lab tests, they have normal IgE level, they have normal skin prick test, and their biopsy even is normal. If you go to the history, you will see at 1980, Cooper found that some 8 women with abdominal pain, diarrhea, and other GI symptoms, 6 of them improved with the gluten-free diet, and this was too much. Then Karkinin at 2000 detected 94 adults with abdominal pain after eating gluten, and 36% of them did not have celiac disease, but they improved on a gluten-free diet. Within the past years, 2 international consensus meetings done at 2011 and 2012 on gluten-related disorders. They need actually better classification, and further study are needed to clarify that. But still, we do believe that those patients, they get benefit from that. Those symptoms, all of those symptoms can occur in those patients with non-celiac gluten sensitivity, and sometimes really they are disturbing symptoms, like all these GI symptoms can cause that. Sometimes they may develop even depression and anxieties, and other even, and some of them, they may develop some rheumatological, and they present with joint problems actually. So those patients really, they need careful evaluation and decision about their diet. I'm going to skip some of this. I'm going to concentrate on food maps. Those are fermentable oligo-di and monosaccharides and polyols. And those are dairy products, and sometimes they are responsible for the development of the symptoms. They are present in many foods, like fructose. It is present in apple, in pear, in watermelon, in honey, lactose, in milk, in yogurt, polyols, sorbitol, and others, also in apple and some apricot, mushroom, and others. So those food maps are sometimes very important, and we should keep that in mind when we are talking about those patient GI symptoms. And so why it is, if the patients has a normal lifestyle, why should take those gluten-free diet? It may not be benign, because there will be some nutritional deficiencies, low calcium, zinc, phosphorus, B vitamins, folate, and niacin, and others. Low fibers, the fiber are protective against heart disease, against colon cancers, and those are very important. And also they protect against constipation, which is sometimes really problematic. Loss of the prebiotic benefits, which because the wheat provide like 2/3 of the oligofactans and inulins, and also it prevent against cancer, cardiovascular diseases, inflammation, and also the wheat may help to lower triglyceride and the other lipid in some small studies, and this is also significant and should be kept in mind when we deal with those patients actually. Also, we will not be able to diagnose celiac disease in the right way when the patient is taking gluten-free diet, although not all people agree on that. And some health complication from not strictly adhering to that gluten-free diet, if the patient has celiac diseases and some self-reported adherence in gluten-free diet, in those even had celiac disease is like up to 80%. And also, it is unnecessary hassle wouldn't rather to eat that cookie, or unnecessary cost. Wouldn't we save that money for a trip or so? I hope I finished within the expected time, and please feel free to contact me at my both email dr_gargary@universityofthehope.ic and at yahoo.com. Thank you very much.
Thank you very much, Dr. Gargary, for this excellent presentation. I have a few questions for you that have come up. First of all, question number one, is there a plan or is there presence of gene therapy for celiac disease?
All the new modalities of celiac disease until this time are experimental. Some of them are in phase 2, but none is fixed now in the treatment of celiac disease.
So not an option at this point?
Yes.
Okay. Is there a role of gluten-free diet after a period of long diarrhea? Does it help?
Actually, it has no rule.
Thank you. There is some evidence with the rotavirus that lactose-free milk diet for that period helps, but so no gluten-free diet is worth experimenting. There is a known association with celiac disease and risk of lymphoma. Does this risk also present with wheat allergy or non-celiac gluten allergy patients?
No, it is in patients with celiac disease, actually.
Okay, so not for the allergy type of reaction.
It is not related to innate immunity or autoimmunity. It's related to the as an autoimmune disease, celiac itself, and not the allergic.
Exactly, it's a different reaction.
Yeah.
Okay. So what about gluten-free diet for children with autism?
Actually, this is a very, very important question. Really, this is very. I do thank the one who asked this question. Actually, now we call it autism spectrum disorder rather than autism itself. And there were a lot of dilemma and a lot of talk about that, but those were on no scientific basis. So, on scientifically speaking, there is no rule of gluten-free diet in patients with autism spectrum disorders.
Okay, thank you. You spoke about the sort of unpleasantness of the biopsy being part of the diagnosis. So there is some algorithms now that are somewhere seen with the celiac disease diagnosis that you can exclude biopsy if the transglutaminase IgA is more than 10 times normal with the positive HLA and positive endometrium test. What's your concept on this?
I totally agree. Those patients can be
diagnosed. You don't need to do the biopsy anymore.
Or biopsy, yeah.
Yeah, it's sometimes very difficult when they have clear symptoms and clear resolution of symptoms and then do. The relationship with celiac disease and chronic diarrhea, is one causing the other or the other way around?
Actually, some patients with celiac disease, they may develop constipation even. So it is not always, sometimes they may develop constipation, but it is due to the sort of villus atrophy those patients, they develop diarrhea. The usual way is that celiac disease is the cause of diarrhea. And but sometimes still some of them, they may develop constipation.
Okay, then there is a question that parents ask often, what about challenging, once you've had the celiac disease diagnosis, is there any point in the lifetime that you should try challenging the diagnosis?
Some school are doing that. After 2 years, they do challenge test, and they see the response. And after the challenge, if the TTG are elevated again, this is permanent, and there is even no need to confirm that with biopsy.
Okay, so the DGG at that point is a clear response. Okay, thank you very much. One question, I'm not quite sure. If the biopsy is supportive for celiac disease, we still need the serology to confirm the diagnosis.
Actually, we start with serology.
Exactly.
And we confirm with biopsy and not the vice versa.
Okay, excellent. So that's clear. If a child has allergy to some, for instance, cow's milk allergy, does that increase the symptoms of celiac disease?
No, it's not related. Those
Not
are
related symptoms. You have one or the other, or you can have both at the same time, but symptoms are more or less the same. Okay. Oh, there's an interesting question. What about genetically modified wheat? I don't know if such exists.
I don't know. Maybe Dr. Azaz will help us in that issue. I have heard about that. I didn't come across those studies in a professional or on scientific sites.
Forums.
But I have come across that by chance.
Idea.
Something, but I didn't find any scientific data about that. I don't know if Dr. Azaz has
maybe we can ask Dr. Azaz, are you there? Can you maybe shed some light on this?
Can you hear me?
Yes, now we can.
Yeah. You know, no, exactly. I mean, as Khalaf said, really, we hear about it, but I believe it is still very, very expensive and really out of commercial use.
Okay, so celiac diet is expensive and the modified wheat diet is even more expensive.
Indeed. Even the ordinary one is actually expensive, let alone the genetically modified, gluten. It is beyond practical or commercial
use at the moment. Okay, absolutely. That sounds sensible. Thank you very much for everybody. And can celiac disease child eat white and brown rice?
Rice, yes.
Yeah, as far as rice is not contained
from
gluten.
The family. It's not from the family.
It's a different family, yes, exactly. So need to differentiate what are the sources for gluten and avoid those substances, and other foods are safe and possible to use.